Podcast 12, Week 14. Welcome to the podcast, Your Pregnancy Week by Week. This podcast covers the 40 weeks of pregnancy in 38 segments and is based on the book Your Pregnancy Week by Week by Dr. Glade Curtis, MD, and me, Judith Schuler, MS. The information in our books and podcasts is a general informative guide about pregnancy. None of the information we provide is intended to replace, countermand, or conflict with the advice given to you by your own doctor. Always follow his or her advice. Use the information you learn here as a starting place in your dialogue to help you put your pregnancy concerns, questions, or interests into words. The goal of every pregnancy is a healthy mom and a healthy baby. To that end, our podcasts cover many topics. In each weekly podcast, we'll highlight information contained in the same weekly discussion in our book. We suggest you read each weekly chapter to learn further information, such as how baby is growing and changing and how you're growing and changing too. Our book also contains illustrations of changes in baby or you, advice for dads, charts, lists, boxes, an exercise for every week, a comprehensive glossary, hints, tips, snippets, and blurbs we just can't reproduce in a podcast. So let's get started on this week's discussion. We're going to look at week 14. Are you into maternity clothes yet? You may have been wearing your regular clothes, but at some point you'll probably have to buy some maternity clothes for comfort. We suggest you don't overbuy. Try to borrow from friends and relatives. You can also check out resale and thrift shops for gently worn maternity clothes. There's one area you really need to pay attention to: your underwear. Panties should be cotton or have a cotton crotch to help reduce risks of a yeast infection. Maternity bras provide enlarging breasts extra support. Some women who have decided to breastfeed choose a nursing bra. If you want to buy one, wait until about 36 weeks. It can be hard to get a correct fit before then. If you have varicose veins in your legs, you may need to wear maternity support hose. These aren't for beauty. They're designed to help support your legs. A belly band can offer support and help avoid some wardrobe malfunctions. Check them out on the internet. Your feet may swell or spread during pregnancy, so you probably need a couple of pairs of good shoes. You may also need to buy larger shoes towards the end of pregnancy as your feet get bigger. I'm sure you've heard about hemorrhoids during pregnancy. Over half of all pregnant women develop them. They're dilated blood vessels around or inside the anus or in the lower rectum. They may worsen toward the end of pregnancy and may get worse with each succeeding pregnancy. Hemorrhoids may bleed a bit when you've been bearing down going to the bathroom. To help lessen discomfort, eat lots of fiber and drink lots of fluid. Another reason to get those 100+ ounces of fluid every day. Stool softeners and bulk fiber products may also help. Ask your doctor about them. If hemorrhoids cause discomfort, let your doctor know. He or she will know what treatment is best for you. After pregnancy, hemorrhoids usually improve, but they may not go away completely. Some pregnant women are concerned about imaging tests like X-rays or CT scans. Before you have any imaging test, always contact your pregnancy doctor. One of the safer tests is magnetic resonance imaging, also called MRI. A friend's daughter had an MRI when she was 15 weeks pregnant to see if she had an appendicitis. They determined she did not, which was a relief to everyone, and it was a safe test for her and baby. No harmful effects on a pregnancy have been reported from the use of MRI. However, experts suggest it may be best to avoid using it during the first trimester. Some problems may require an X-ray for diagnosis and treatment. Discuss the need for X-rays with the doctor treating you and your pregnancy doctor. It's easier to deal with questions about safety and risk before a test is done. CTs or CAT scans are a form of specialized X-ray. The technique combines X-ray with computer analysis. Many researchers believe the radiation from a CT scan is much lower than from a regular X-ray, but always be cautious about having these tests. You need to take good care of your teeth during pregnancy. It's important to brush and floss every day. By doing so, you're protecting baby. If you have a gum infection, it can pass into your blood, then pass through the umbilical cord to baby. This may cause many problems for babies, so keep that toothbrush and floss handy and use them every day. Being overweight during pregnancy can present challenges. Up to 38% of all women are overweight when they get pregnant, and 8% of these women are obese. Research shows over 65% of overweight or obese women gain more weight than they should during pregnancy. Gaining too much weight can make carrying baby uncomfortable, and vaginal delivery may be more difficult or even impossible. We don't want you to diet during pregnancy, but you'll probably have to gain some weight. Do gain your total pregnancy weight slowly. Eat nutritious, healthful foods and eliminate those with empty calories. Ask your doctor about swimming and walking, which are good exercises for any pregnant woman, and try to exercise 5 days a week. Are you pregnant and currently on active duty in the military? If you are, you'll face many challenges. Work hard to eat healthy food so you have adequate levels of iron and folic acid. Examine your job for hazards you may be exposed to. Before receiving any vaccinations, talk with your pregnancy doctor. Each branch of the service has particular policies regarding pregnancy. Our book covers some of them. And check with your military pregnancy doctor and your superior if you have questions or concerns. Changes may have to be made. We don't talk about specific exercises in our podcasts. Those are included in our book, Your Pregnancy Week by Week. But there is one exercise every woman should do every day, pregnant or not. It's called the Kegel exercise, and it strengthens pelvic muscles. Learn how to do it, check the book, and practice it every day to help relax muscles you'll use for delivery. The exercise can also help get vaginal muscles back in shape after baby arrives. This one exercise can help with incontinence throughout your life, so practice it every day. Remember, our podcasts give you the highlights of what may be happening in any given week. Check our book, Your Pregnancy Week by Week, for more detailed information. You may also want to check out our book for partners, Your Pregnancy for the Father-to-Be. It covers pregnancy from a man's point of view and provides lots of valuable information a man may find very useful. If you want to find out more about our podcast, visit our website, yourpregnancyweekbyweek.com. If you're looking for something specific, check out the podcast topics list. It details topics covered in each podcast, so you can listen to a particular podcast or read a certain chapter week if you want more information, or if you want to check out something you missed or a topic we haven't covered yet.